When this pandemic started, there was a lockdown because people didn't know how many hospital beds were going to be necessary. Smart advice. Now, 6 months later, there is another lockdown throughout Ontario, and the University Health Network in Toronto has over 1,200 beds, and I'm informed there are 11 cases of COVID. Lorrie Goldstein is a well-known columnist with the Toronto Sun, been the editor, you know all this stuff, you watch this stuff. It doesn't seem to make a lot of sense to keep a lockdown here now, especially when the WHO has changed their advice and we are killing the economy and killing other people.
Well, the first thing from what you said that it strikes me is that we've heard that, to use Ontario as an example, 150 intensive care beds in the whole province. And if we get to 150, then, well, the elective surgery starts to go. And if we get to, 300, then Armageddon occurs. How in a province of, 14 million people.
And a lot of money.
Do we have 150 beds before it becomes a problem, and at 300, we can't do anything? So that's the first thing. In this all this money we spend on healthcare, are we ground to a halt by 350 intensive care cases of COVID? That's the first insanity to me. The second point is that when you look to general beds,
right.
There was a recent Fraser Institute study. We're one of the lowest in terms of beds per population, one of the lowest in all industrialized countries in the world. So all I'm saying is that exacerbates it, because they're concerned, like you say, there may be very few now, but they're concerned if the numbers take off and they suddenly get hit,
beds.
And so to me, the problem is nobody thought of this for the past century, that we don't have enough intensive care beds when there is what if there's a horrible accident on the highway and 150 people need intensive care? We shut down the province? Like how did we get to this point?
So why are we locking down when we aren't using these beds? The purpose of the lockdown was to make sure that we would have enough beds. There's no need for it now, and people are saying still locked down throughout Christmas. People are dying, businesses are hurting, economies are just going down the tank, and our government is still saying, against the advice of the WHO, lockdown, because we said so.
Well, look, at the beginning of this, the argument was it's going to be horrible if we don't protect the elderly properly, right? Right. But now we're in the position where there's nothing perfect here. There's nothing that works. The frustration is, I think, that people look at the survival rate of COVID-19 and they go, well, most people, it's not impacting. So why can't we live our lives? But the problem is it's so infectious that most people will get it and survive, but a relatively small number will get it and be very sick, and they have to go to hospital, and we don't have enough spaces in the hospital to look after those people.
So the bottom line is, wash your hands, wear a mask, socially distance.
Assume that you've got it and everybody else has got it, and act that way. That's all you can do.
3 minutes. Thanks a lot. The numbers are in, and it's obvious that more and more people are watching this show because you are getting the precise and concise news that you would not get on the mainstream media. And in the meantime, I guess we're cheesing a few people off. That's clear from the fact that Randy Hillier, MPP, was censored. You can see my views on that on stephenledrew.ca. So we have to keep this going. We started it as a project. We are running out of money. If you know someone who wants to advertise or to sponsor this, please fill in the form, because we are determined to keep this news on the air for you.